The visits here are going to be with both Dr. Ellman and myself. For those who have hip dysplasia and labral tears, they'll see both of us.
When you first come into our clinic, we have a pretty well-oiled machine at this point, right? We see a ton of patients, but we really focus on each patient as an individual and really try to kind of give them all of our attention. One huge advantage for Ron and I is that we both do clinic together.
Essentially, we start with a history. We make sure there's no issues that are in your medical past which may be contributing to hip problems. And then we do a brief physical exam as well. A lot of the times we have to take a look at your hip by imaging as well. So you'll get regular x-rays in the office here to look at the shape and morphology of your hip joint. Oftentimes we'll also get an MRI which looks at the softer tissues like the cartilage of the joint, the labrum, the capsule, the tendons that are around the joint, etc. And then with a combination of Dr. Ellman's experienced eyes and my experienced eyes, we'll take a look at all the imaging, put the picture together, and trying to come up with a good comprehensive diagnosis for what explains the hip pain that's happening.
So it's really easy for me to go next door, say, Dr. Huguet, you mind coming and looking at this x-ray? You mind coming and talking to this patient? And vice versa. And we share patients all the time, which I think is very special from our standpoint in terms of working a patient up, meeting families, and being able to communicate really easily from the beginning. And so we start there and we'll get the whole picture, right? This is not something that is very simple from a diagnostic standpoint. This is not an ACL tear. This is not a meniscus tear. This is something where, yes, you may have a labral tear, but you may have a cartilage defect with it. You may also have dysplasia. You may have a rotational issue with the femur or microinstability of that hip. And we need kind of all hands on deck, everybody coming together to kind of figure this out and put our brains together and come up with the right diagnosis for you.
Dr. Ellman focuses on the things that are inside the joint, so the cartilage, the labrum, the capsule, any sort of anatomic issues inside the joint that need to be taken care of. When you see me, I'll be taking more of a look at the bony architecture of the pelvis, of the hip joint itself, of the femur, the bones below the hip joint as well, to see if there's any deformities that are contributing to the pain that you're having in your hip joint. So it's a team approach. We have a day where we're all together on the same day in adjacent hallways, and you'll be seeing both of us to get assessments of both of those things.
Once we do all of these studies, Dr. Huguet and I will look at the studies together. We'll kind of come up with the best game plan for you. A non-operative plan, which most of the time we start with, versus a scope, right, which is what I do, or versus a combined procedure, which is what Dr. Huguet and myself do. This workup usually takes a couple weeks, truthfully, sometimes a couple months. Sometimes it takes the first day, right? We see it, we know it, patients are in a lot of pain. We're not gonna make you suffer. We're gonna make sure it's the right decision for you.